Most women with PCOS are told one of two things: just lose weight, or here's birth control. And if that hasn't worked for you, it's not because you're failing, it's because PCOS is not a one-size-fits-all condition. It's a spectrum, and if you don't treat the root cause, you'll keep feeling stuck. Hi, I'm Athena Newell, family nurse practitioner in functional medicine at Stat Wellness in Charleston, and I work with women every single day to help them optimize their hormones and feel their best. So what is PCOS? PCOS stands for polycystic ovarian syndrome, and it is one of the most common hormonal conditions in women. Despite the name, it's not just about cysts on your ovaries. At its core, PCOS is a metabolic and hormonal condition, meaning it affects your insulin, your hormones, your metabolism, and your body composition. What are the most common PCOS symptoms? PCOS shows up differently in every woman, but here's some of the most common symptoms: irregular or missed periods, acne or oily skin, hair thinning or hair loss, unwanted facial and body hair, difficulty losing weight or unexplained weight gain, fatigue and low energy. I even see this overlap into mental health issues and fertility challenges. Some of the biggest drivers behind these symptoms are insulin resistance and testosterone overload. Let's talk about insulin resistance and body composition struggles, which is one of the most common complaints of patients with PCOS. Insulin resistance is when your body produces more insulin to balance your blood sugar. Over time, this excess insulin can become inflammatory, result in fat storage, especially in the abdomen, make it difficult to build and maintain muscle, and cause blood sugar crashes, which cause cravings, fatigue, and irritability. Here's the kicker: you can have insulin resistance even if your labs look normal, and even if you're not overweight. I find in medical practice that insulin is not a very common lab that is drawn in conventional practice. We mainly draw an A1C. You can have a normal A1C and still have insulin resistance. We diagnose PCOS using something called the Rotterdam criteria. You need 2 out of 3 of the following: 1, irregular or absent ovulation or cycles; 2, signs of elevated androgens or testosterone, which result in symptoms like acne or unwanted hair growth; 3, polycystic appearing ovaries on ultrasound. And here's where it gets nuanced. You don't need all 3 to exhibit symptoms of PCOS, which is why PCOS can look very different from person to person. So typical labs that I like to draw if I suspect PCOS in my patients, if they have not already been diagnosed with it, is a CMP or complete metabolic panel with a fasting glucose. We also like to look at A1Cs and fasting insulin. We do have optimal levels for fasting insulin, even in our non-diabetic patients. Our women's panel also includes DHEA measures and testosterone, which are related to excess androgens. I will also add on an AMA if I suspect PCOS. Between labs, symptoms, and the Rotterdam criteria, which we might send patients out for ultrasound, between all of those things, we can decide whether our patients are likely to have PCOS or are on the PCOS spectrum and could benefit from treatment. PCOS is a spectrum. Some women struggle more with insulin resistance, while others might struggle with inflammation, stress, or adrenal dysfunction. I've even had patients who have no signs of PCOS, but upon further evaluation, it seems they're having anovulatory cycles, and they benefited from a plan that focused on PCOS. So while medications can be helpful for some patients, I find that a combination approach is necessary. Let's talk about lifestyle management. Number 1, exercise. First, let's talk about exercise. This is one of the most important tools that we have. For PCOS, the goal is to improve insulin sensitivity and to build muscle. Improving insulin sensitivity can help overall body composition and limit inflammation. Building muscle increases our metabolic demand, which can also help our metabolism. Here's what I find works best for our PCOS patients, because I do not think that they do very well on adrenally driving high intensity exercise. Number 1, strength training 3 to 4 days a week. I really like progressive overload because it's focused on building muscle and increasing strength over time, which increases our metabolic load. Number 2, walking daily. This is wildly underrated when it comes to blood sugar management. This is especially important after meals. Number 2, limiting high intensity training to 1 to 2 days a week in short bursts. This can limit adrenally driving activity that can make PCOS worse. I would caution against excess cardio and underfueling while training. If your body is already stressed, more stress is not the answer. Now let's talk about our nutritional approach. You don't need a perfect diet, but I do think PCOS patients benefit from a strategic one. Focus on protein at every meal, aiming for 25 to 30 grams. Fiber-rich carbs. Don't eliminate carbs, but choose wisely, and incorporate healthy fats to stabilize blood sugar. I try to point all of my patients to a whole food-based diet because I think most of us can benefit from them, but particularly in PCOS, I think it's best for us to limit refined carbs and highly processed foods. Here's some helpful strategies. Don't skip meals, and start your day with protein. Coffee is not a meal. Now let's talk about supplements. I actually find some of the PCOS supplements to be very beneficial. Number one, inositol. Inositol supports insulin sensitivity and ovulation. Magnesium helps with stress management and adrenals. Omega-3s reduce inflammation, and vitamin D is common in PCOS patients and great for metabolic support. But supplements should support your plan, not be your foundation. Now let's talk about some medication options. I try not to lean solely on medications, but I do think they can be a helpful tool in treatment-resistant PCOS. Some medications that can be considered is metformin for certain patients. This can improve insulin resistance. GLPs can be supportive to support weight and blood sugar, and it does help limit inflammation. Hormonal birth control, especially for our patients that are not having periods every 90 days, but I do find with some of my hormonal supports for these patients, we are able to avoid birth control. Spironolactone is a really common medication that helps with acne. I also think that some of our hormonal and supplemental supports help improve acne over time, so we can stay off spironolactone. If we're combining lifestyle, exercise, nutrition, some supplements, I do find that we can limit the use of medication, but they can definitely be a helpful tool. What I really try to emphasize is that we start with lifestyle first and layer in medications as needed, but not as our first and only resource. Some other whole person approaches to support PCOS patients are thyroid function, stress and cortisol, sleep quality, and gut. I do find that a lot of our PCOS patients have impressive adrenal and gut dysfunction. So it's helpful for us to address these things as a root cause approach as well. Because if some of those things are off, hormones will be harder to regulate. So if you're struggling with PCOS and feel like you've tried everything and nothing is getting better, you deserve a plan that actually fits your whole body. If you want to figure that out, I offer free 15-minute consults at Stat Wellness to take a deeper dive into your symptoms, your goal, and what the best next steps are for you. You can book an appointment at the link in the bio. Thanks for coming.